This video continues Chapter 16 of OEC 6, looking at GI, GU, and reproductive system emergencies. And in this case, we're really going to focus on Objective 16.4, looking at signs and symptoms of reproductive emergencies. A couple of key terms that we'll encounter this time will be peritonitis, pelvic inflammatory disease, and we'll define what an ovarian cyst or an ectopic pregnancy are. Let's take a look. Just a quick review in terms of the female reproductive organs. The upper part, such as the uterus, the fallopian tubes, and the ovaries, are going to be found in the abdominal cavity, extending down into the pelvic cavity, with the cervix and the vagina inferior to the upper part of the organs there. When we consider what's going on and they're affected by disease, signs and symptoms will mimic those of acute abdomen. So we have to be very careful in our patient history to maybe distinguish the difference between a GI or GU emergency and a reproductive emergency. An ectopic pregnancy is the first one we'll consider. Now, in this case, the fertilization of an egg, which normally occurs in the fallopian tube, just does not implant down in the uterus after traveling there, but rather implants in the fallopian tube or elsewhere outside the uterus, and this ectopic pregnancy will occur. Now, that small fallopian tube limits the development of the fetus, and so consequently, as the fetus grows, we'll get severe pain as the tube enlarges. Bleeding can occur with this, can be massive. An ovarian cyst is a fluid-filled sac or pocket in an ovary or on the surface of the ovary, oftentimes in an inferior position there, and they may present little or no discomfort unless they were to rupture. Many of them will actually disappear without treatment over time, but this potential for rupture is something we want to consider. Those that have ruptured will present with pelvic pain and fullness in the abdomen, and rapid medical follow-up is going to be needed. Keep in mind that if internal bleeding was to occur, the patient will present as being shocky. Pelvic inflammatory disease is an infection of the reproductive system, and that infection could occur in the uterus, the ovaries, the cervix, and it's typically caused by an STD such as chlamydia or gonorrhea. Treatment is with antibiotics. Now, the presentation of this for the patient can still be severe abdominal pain. Oftentimes, the condition will be painless, but if it is severe, we'll see some of these things such as the patient being febrile. They'll have a fever because of the infection, and they'll also have the lower abdominal or pelvic pain associated with that. For the male, the reproductive organs are typically outside the pelvic cavity. Some are inside, but principally they're outside. The testicles are inside the scrotum and hanging outside below the penis. Testicle trauma is going to be very painful in the case of a straddle injury, for example, and we can have associated problems such as swelling or bleeding with that. A rupture of the testicle could occur, and so trauma to this patient should require follow-up with a physician. One special injury to consider is testicular torsion, which is rotation of the testicle and the consequent twisting and occlusion of the artery that brings blood to the testicle. So that's going to be very painful. It often occurs in adolescent males, and it's going to usually require emergency surgery to reverse that and save the testicle. We finish our discussion of common emergencies by just looking at acute abdomen, which is sudden severe pain, and it could encompass many different medical problems in the abdominal or pelvic cavities. It is not the job of the OEC technician to identify the source of the problem. It could be any of the reproductive emergencies that we've looked at, such as ectopic pregnancy or an ovarian cyst. It could be something with the GI system, such as appendicitis or pancreatitis or gastroenteritis. It could be something even higher, such as a perforated ulcer or gastritis and GI bleeding. In any case, it's most important to just recognize that the patient is very ill, rather than trying to exactly pinpoint what's going on. The hallmark of acute abdomen is just severe pain from the inflammation of the peritoneum. Here's that suffix itis, meaning inflammation, the prefix for peritoneum, which is the thin membrane that encases the entire abdominal cavity. It's what's going to be inflamed, especially when contacted by blood or contaminants such as gastric contents. The patient will be guarding their abdomen because of the pain. We also may see some distension and rigidity in the abdomen as well, alongside symptoms such as nausea and vomiting, potentially fever and shock.